Hey everybody, it's David. I'm the host of Highway to Health podcast, and we're doing a series of episodes today here at Billy Bob's. It's the largest honky-tonk in the world. I have some good memories here. My wife and I come here often. We're on the same stage as some of the best to ever do it, whether it's Willie, Waylon, George Strait, Garth Brooks. They've all performed on this stage at one time, and we get our chance today. We're talking to healthcare executives in the DFW area. DFW has grown into this healthcare hub. 200 years ago, it was the hub or the mecca for the cattle trade. We've evolved a little since then, and healthcare has taken a foothold in DFW, which is a really good thing for this community and for the industry. And that's why I'm excited to talk to the first couple of healthcare in DFW, Jeff and Laura Lee Tanner. Welcome to Highway to Health.
Thanks.
Thank you for having us.
Thanks for being here. So tell me, in your opinion, why has DFW grown into this healthcare hub that has some of the best providers, some of the best innovation, some of the best technology and partners in healthcare all coming to DFW? What's going on?
I think the healthcare follows the people. And I love Texas, and I think Texas is a very easy place to do business. I mean, you look at some of the companies like Toyota that have relocated their U.S. operations here, right? So wherever there are people, healthcare has to follow. And so I think, you look at the metroplex, and we have very large, very innovative health systems that have continued to develop. And some of them have been here a long time, but they have continued to develop, have continued to acquire facilities to support our population, correct? So wherever you have hospitals, you also have service providers that move in to support those hospitals. So I think that's what's really happened here is, it's the people, it's the health systems, and it's the service providers that have come in.
Yeah.
I agree with you. I think the population growth is certainly a factor. And, in Texas, if you think about all the rural communities outlying the cities that we have in the state,
Right.
they're going to come into the, urban areas for that healthcare. We have a lot of space in Texas. And I think the innovation part, I think Texans are just generally the type of people that we're going to do it better. We're going to do our best. And I think you see that in the way that we try and be, world class in whatever we do. Healthcare is no exception.
I agree with that. Everything's bigger in Texas. You could argue everything's better in Texas.
We could.
Absolutely. I mean, you even look around to, neighboring states. I mean, my father lives in Arkansas, and there's certainly, good health systems in Arkansas. They're not nearly as plentiful, nor as advanced. So when people need that real specific healthcare assistance, I mean, a lot of them are driving. I mean, it's a 5-hour drive from Little Rock to DFW, right? So I think we're also not just pulling from communities and outlying communities within the borders of the state, but we're pulling from other places as well.
It's become kind of a destination.
It has.
I think we're pulling from international countries as well. We have some of the best cancer research, some of the best cancer treatments. I can attest to myself in the state of Texas. And I think when you look at these other states that border us, when you look at their total population, you could fit them into DFW, right?
True.
So that's a factor. So you may not get the opportunity for that growth in these border states that we are blessed to have here in Texas.
I agree. So tell me a little bit about the roles that you play in this community, in this ecosystem.
I like to think that my role is to make healthcare better from the standpoint of helping facilities to operate at full efficiency, but really strengthening that bond within their community. Sometimes that community bond gets lost between our patients and our providers because you have this middleman who's really handling your relationship. He's saying, they're the problem and it's not you. And so we start to lose that focus on who our patients and our community and our customers are because we're dealing with these guys. I think that we've got to refocus off of them and start focusing on our relationship with our customers, our community, our patients. And that's where I can come in the revenue cycle transformation. I can help hospitals do a better job, to manage that very fragile relationship between the hospital providers and that community they're in.
Becoming more and more fragile too.
Yeah, it is. It is because when you're at the hospital, it's probably not your best day.
Right.
And then the follow-up to that is we're probably going to make your day look a little worse because you might get a bill. Yeah. Now, if the system is working properly and we're working with your insurance and they're working with us as they should, it could be a lot smoother. But unfortunately, that's not the way it's happening right now. And that's a conversation we've had before, and it's one that I'm afraid will continue. But I believe that if hospitals take their focus off of the insurance, you deal with them because we have to. But remember who our relationship is really with, and that's our community.
What about you, Lorley?
My entire career, I've been in healthcare. I've touched every aspect, I feel like, of healthcare. I mean, early in my career, I was implementing systems in hospitals and have been in revenue cycles since '99. And I think when I kind of peel back the layers of the onion to say, okay, what is it you really do? I'm a relationship person at heart. So, even in an operational role or a sales leadership role, I'm that connector. Having been in this business so long, I know people all over the country. So I often connect people with others, with like-minded folks. I can be in Florida and they say, how do they do this at XYZ hospital across the country? So, kind of making those connections, relaying those stories is what I do. I mean, it was shocking to me. I worked with a very large health system at one point and worked with a lot of the hospital executives, regional as well as at the local hospital level. I also started working with some of their physicians, and it was amazing to me that the hospital people didn't know the physician people, sure as heck didn't know the value-based reimbursement people. So being able to kind of build on those relationships, make those introductions, sometimes within the same four walls of the hospital,
right.
And just really talk about how other areas of revenue cycle or other areas that maybe they haven't explored could be beneficial.
Oh, yeah.
Right? I mean, think about population health management, what that can do for both a provider in terms of pulling business to their hospital, and what it could do for an employer. Often they're just not educated. They haven't thought about that. So being able to talk about that at a high level or a very granular level, just to get people thinking more broadly.
Yeah, I think that's one of the inspirational things that we've seen lately in healthcare is the collaboration that's happening and the complementary relationships that we can build to do it better, to be more efficient, and to treat those patients the way they need to be treated, deserve to be treated. Revenue cycle is actually, it's my favorite topic in healthcare. It's like, your first love. I got into revenue cycle about 12 years ago and fell in love with it because it's this beautiful intersection of business, people, service, and it's the lifeblood of our providers. And to do it well is really hard. And so it's an ever-evolving challenge. And that always kept me very interested and engaged. And it stays that way, even today. And when done right, I'd like to get your opinion on this. When done right, what can the revenue cycle mean to the larger community? Not just the provider, but also the community, the people that it touches.
I'll take this first. I am a firm believer that if you get things done correctly in patient access, at the point of access, if you get that done correctly, theoretically, you should work yourself out of a job in AR management. Think about it. if you get it done right, you verify insurance, you get everything, get the patient registered with the correct insurance and plan, right? You get everything done. You talk to them about their patient responsibility. You do everything up front. That claim, assuming that it's coded correctly, it should sail through clean, right? You should have 100% clean claim rate, right? Yep. And yet we don't. And why? Because hospitals are not putting enough emphasis where it needs to be, patient access, right? And what does that do for the community? Think about when it's done incorrectly.
It's the first face you see when you walk in the door.
So it's, people could go into a hospital, have a fabulous clinical experience, and then if they have a poor financial experience, it's shot. It doesn't matter how good that doctor is, how great that nurse was. It doesn't matter, because my experience at that hospital was awful, because they billed me for something that I wasn't responsible for, or they billed me for something I wasn't expecting.
And it's the easy,
right?
It's the easy response from the patient, because that's what we've always been told.
Right.
Healthcare is so expensive. It's too expensive. I'm not even going to go anymore.
No.
Because I can't afford it.
Right. And I think that there are so many tools out there now. I mean, I don't think we're doing a good job up front getting people enrolled in Medicaid, or getting people enrolled in the exchange.
Sure.
Or if those aren't options, offering them a patient financing plan.
Right.
Offering them a solution that says, hey, come to our hospital. We care about you. We want to treat you. We will give you options for how to pay for that. And I think that when it's done correctly, it can give that patient and give that community kind of that breathing room that now I need to take care of myself. I mean, my biggest complaint in healthcare, and this is clinical, we treat symptoms. We don't treat the problem, right? We don't have enough people that are going out and getting, diagnostic work or preventative stuff. It's like we all expect to take a pill and it's all going to be resolved.
Right.
Right. And all right, I'm going to get off my soapbox in a second, but one thing I want to say is, Jeff and I have been married 18 and a half years. We had just moved to DFW, and he was diagnosed with non-Hodgkin's lymphoma. It was horrible. And as you can imagine, and you're talking about two people who have spent our lives, our careers in healthcare.
Right.
And I can tell you right now, we got stacks and stacks and stacks of EOBs. We got stacks of bills. And it was so stressful on us. And you're talking about two people that know this business, David. Can you imagine people that don't know our business and getting those stacks? And I still remember where on our bar we stacked those bills. And at one point it was like this. And it was either, deal with it and you're depressed, or look at the stack and you're depressed.
Right.
And we're not doing enough to address that.
And that's where it goes back to that service part of what I was talking about. In the toughest part of your life, the toughest phase of your life, the added stress from exactly what you just described is not something to neglect. It's not something to just act like it's part of the process. It's part of the routine, because it can't be. You got to be completely focused on your health at that point.
Right. And I'm not a clinician, but I would argue that when you have a patient who's trying to, they're going through chemotherapy, they feel yucky, they're getting $10,000 injections at a time, right? It's hard to heal when you're under that much stress. All right, I'm off my soapbox.
Well, everything you said is 100% accurate, and it all does start at the first contact. And that first contact actually comes even sometimes before you enter the hospital. We need to be proactively talking to patients so that we can get their information prior to their visit, so that we can get them the most accurate information. Your insurance is this, here's how much your deductible is, here's how much your copay is, and here's what this is going to look like. We do, I hate to say it, we do such a poor job in the hospital, because let's say I'm coming in, I know I need to, have my gallbladder out. Let's just use that as an example. Well, it's not just one code that, gallbladder removal, it's this. There are several things that are going to be on that bill because they have to. Even though we're not actually expecting to be paid for them, they're called bundled service. But those are the things that a patient's going to see on their bill.
Right.
And they're going to be like, wait a minute, you told me it was this, and you're sending my insurance company a bill for this. It's confusing to the consumer, and frankly, I think it's designed to be that way.
Right.
HFMA had this patient-friendly billing initiative. Well, that just kind of went nowhere because the complexity of our business is getting to the point where it is just, you have to have staff just to keep up with today's regulation.
Right.
What do I have to have for, Medicare? If they ever come in, if Medicare started doing more audits, God bless these hospitals, they're in trouble. You talk about all the options of how do we get you potentially on a state program, Medicaid, the federal program, Medicare? How do we potentially get you into the exchange? What is our charity care policy? Most of the time you go up and you ask your front end staff, you might get 3 different answers, unfortunately, because we don't train. We don't have time to train.
Right.
Because this business is becoming so complex and so overburdened with regulation that it becomes nearly impossible to manage. It's a beast.
It is a beast. And that was my next question is why is it so hard to run an efficient revenue cycle? The complexity is the answer, but what does that even mean?
Well, I want to touch on this because one of the things I think that, hospital executives need to be doing is getting out to their local community colleges and starting to build programs. We do it for coders. There are tons of coding schools out there in the market because we always need coders, right? But we also need patient access people. We need billing people. We need several roles that require training. Yeah. And right now what we do is we say, well, Margaret's been here longer than everybody else. Margaret, you train her. Well, God bless Margaret, but how do we know who trained her? And has Margaret been retrained?
Right.
What training has she gotten in the 20 years she's been here?
Since yesterday when things changed.
So we need to have programs at the local community colleges. Healthcare is an amazing opportunity for young people for career advancement. What do we do to market our industry? We don't. We go out and we hire somebody who doesn't have healthcare experience, and we do our best to train them. And we're frankly not very good at it. So that's one of the things that I think folks need to do. Now, why is it so complex? Let's get there. That's the crux of it. The reason is because, I'm just going to say it might not be popular, but insurance companies own our government regulations. These guys have the largest buildings in the biggest cities. They're making record profits every year, and they control how the system works, right? We send you a bundle of codes, and frankly, they're just trying to look and see, what did you miss? How can I delay payment? How can I not make payment? And so what happens with that bill is it continues to age, and we have people in the hospital who are having to try and figure out what it is the insurance company wants and try and get that back to them. You might go through that iteration once or twice. Eventually, you've got to let that go because now you got a new stack of denials that have come in. And we're fooling ourselves in healthcare. I listen to hospitals tell me, we've got a 93% clean claim rate. You do not. You do not. You might think you do.
They may be going out claim, but what's that payment rate?
Exactly.
Like?
But are you looking at what you should have been paid? Are you looking at what you got paid and you're looking at the difference, and are you challenging these insurance companies? When I go in most of the time, the charge master's not up to date, our contract management system. And Laura Lee talked earlier about these, support companies, these services companies. It is an industry in and of itself, the people who just help hospitals. And that's increasing the cost, frankly, of our healthcare. But it's required because of the way our system is built.
Right.
And I think you and I talked about this a previous time. We're not doing enough to go on our hospital's behalf and speak with our state legislatures, speak with our congressional representatives. We should be going there. We shouldn't depend on these big national organizations to be. I mean, come on, think about it. You got rural hospitals, you got urban hospitals. You've got everything in between. One organization is going to represent every state in the nation. You can't. You've got to take that upon yourselves. The executives need to start getting engaged in how their business is regulated, because it's becoming just way too cumbersome.
That's kind of my next question is, we're living in this golden age of innovation. You drive up and down 35 or the tollway and you see all the new companies and technologies that are promising to fix it, to automate it, to scale it. But in your opinions, what's the biggest lever that we can pull to balance the power in healthcare so that our providers can start delivering the type of care, the type of experience, the type of access to our patient community that we all need? What's the biggest lever that we can pull in healthcare right now?
I think that's the $1 million question. You know, I'm always shocked at the number of hospitals that don't know about the technology that is available and, quite frankly, has been available for 20 years, right? They either don't know about it or they haven't implemented it. It's astounding to me, the number that aren't checking for eligibility. I mean, it's a basic 270, 271 transaction that's been around since forever, right?
Yeah.
But they're just not implementing it because why? They don't want to spend that money, right? They don't want to pay for that transaction, or my favorite answer is, doesn't Epic do that? Everyone thinks.
If I had $1.
Huh?
If I had $1.
Exactly. But I think that's the biggest problem. And, and quite frankly, you go to these conferences where healthcare executives should be able to get that type of education, but they're not going. Why are they not going? Because it's a vendor fair.
Uh-huh.
I mean, any of these meetings, whether it's HFMA or Becker's or whatever you call it, it's 70% vendors and 30% providers. And they go and they hear things and they bug.
And they get vendor fatigue, solution fatigue.
They get vendor fatigue. And look, I'm a vendor. I mean, I go there because I want to be able to talk to them and engage with them. But it's tough because we're not getting out of it what we need to get out of it.
Yeah.
They need to be there to be educated and I think sometimes having these conferences in places like Las Vegas, that's a big distraction. People don't go sometimes. And just we've got to figure out that education, that piece of it, so that they know what this technology's about.
Right.
I mean, they have a tendency to know the big names, but there are a lot of other companies, startup companies, some right here in DFW, some that are in other parts of the country, but that are national companies that have really good solutions. But you said vendor fatigue. I don't want to talk to another vendor. I don't care what they're doing. Tell you what, they better care. They better care. They better start learning to care.
And the objections are too easy. On the provider side, it's we don't have money. And even if we did have money, the time it would take to implement and then manage the change.
I don't have IT staff.
Right.
That's my favorite one.
Can't get you any data.
All right.
I want to take a shot at this because I think it's important. We've got to stop focusing on the next shiny thing. Right now, all you're hearing about is AI.
Yeah.
AI, finally, something's going to solve all our problems. Whether it be, it's Epic, it's going to solve it. This, we've got to stop looking at just this technology as a solution. The solution is we've got to start working on our business, not just in our business. You've heard me say it probably till you're tired of it, but it's factual. We have got to start looking at how to run our businesses efficiently, to understand our business. Every executive should understand their revenue cycle. And what is the other lever that I believe is critical is we are in a diagnostic healthcare society, right? So we are not in a preventative society. Mm-hmm. The doctors who should be making the most money are frankly primary care, family medicine, internal medicine doctors, because they're the ones that have the opportunity to set a patient on the right track to get healthy. But instead, our highest paid are surgeons, and they are doing very well because everything requires a surgery.
Everything's a break fix.
Everything's a break fix. Could I go through PT for a year and fix this? Yes. But, I have a surgeon who tells me he'll fix it overnight. And so it's an insurance company paying the bill. So which one am I going to take?
Yeah.
We got to start taking responsibility for our own healthcare, right? We've got to start saying, how am I going to get out of this mess that I created? Yeah. It's not going to happen overnight. It's not going to be easy. But as a community, we need to start thinking about how we take care of ourselves. We have the information. We just have to take action.
You know what? I've said this. This is a passion of mine too. And you can even apply this to like your personal finances, there are other areas of your life. There are outside factors that you cannot control. And sometimes those events make a major impact on your life that you can't control. And there are professionals there to help you guide you through that journey. But we as patients do need to own our behaviors and our habits. And a lot of times, whether the food we eat, the way we move our body, the things we expose ourselves to lead us down a healthcare journey that is only going to lead to a break-fix solution. And I think we can manage that a little bit better. Sometimes what that means is I have to be educated on what those options are and what the right decisions are. And I think that feeds into what you were saying, Jim.
Our first line of defense for that is the primary care physician.
Yeah.
But I think what you're describing is systemic of healthcare. It is systemic. It is how patients react. It's how doctors react. Healthcare is all reactive. Revenue cycle's reactive, right? So if I think of, I know we think of revenue cycle either as linear or in a cycle, whatever it is. I was thinking about this yesterday. To me, it's almost like the food pyramid. You know how they've told us turn the food pyramid upside down?
Yeah.
What if we took the revenue cycle pyramid? If the revenue cycle pyramid was patient access, mid-cycle, and AR management, isn't that what it looks like?
Yeah.
That's
kind of the area of focus.
Right?
Level of focus.
But with the tip of the spear, those are the people that talk to our patients first, but they're typically the lowest paid.
Well,
right?
Yeah.
And there are fewer of them. And it's kind of, look at any of the revenue cycle outsourcing companies. Where do they start? They built their business based on AR management, then they back into coding, and then if they get into patient access, they just rebadge everyone from the hospital and hope for the best. Think about it if we were to flip that upside down and put more people on the front lines talking to patients and really looking for getting that right coverage,
yeah,
helping them pay those bills. Think about, you would need so many people, but again, it's reactive.
You are absolutely right. And we've talked about this before, Davis. These folks are the lowest paid. Yeah. There are fewer of them. You know why? Because they don't bring in revenue. And this is one of the mistakes every hospital executive makes, is they start looking at people and say, well, they don't bring in revenue. Every single person in a hospital that works for that facility is a part of the revenue cycle. Every single one of them. Right? So it's about investing in your business. Well, do we need a 32 slice CT versus a 16 slice? Or do we need more people who are going to be training and getting our folks to do a great job through the cycle so that we start generating the income that we've earned? Right? It's just the mindset is upside down in our industry. We do not operate like other businesses. We just don't.
I want to tell you a story, this is from 2005, okay, quite a while ago. So, and I'm just going to call out this hospital because it was a great story. So, Orlando Health. At this point, it was Orlando Regional Medical Center, and Keith Eggert was the longtime VP of Revenue Cycle there, and his patient access VP was Craig Pergram. Unfortunately, or fortunately for him, Craig just retired. But, Craig and Keith were the ones that really were the only hospital I've ever really worked with, were really forward thinking about patient access. Initially, all their patient access staff wore scrubs Do you know how confusing that is for a patient walking in and they see someone sitting there wearing scrubs? And Craig said, you know what? We need to professionalize this. These are the people that greet our patients when they first walk in the door. And you know what they did? They got a Lands End catalog. And every person they hired, not only did they train them on customer service and all the things we've been talking about, they gave them a Lands End catalog and they said, you have a stipend, go pick out a uniform. They elevated patient access. They also implemented technology that would identify any registration errors. And it worked. It worked. And that was 2005. And that is, unfortunately, it's the only hospital I've ever talked to that's actually done something like that. I mean, they may not allow hospitals to wear scrubs anymore, but I mean, to me, it was so forward thinking. And that's the mentality. We got to continue to think of these ideas.
There's a theme here, whether we're talking about revenue cycle or our personal health. There are little things that we need to get in place first. There are foundational elements that we need to secure and lock down, patient access being one of them. And then we can start building upon that strong foundation with some of these other technologies. And maybe we would be less fatigued looking at these other solutions if we had the core elements of our business.
Absolutely. You preach it.
I'd like to hear your opinion.
Well, you're absolutely right. And this is when I'm not bashing technology. Technology can be a wonderful tool. It is not the solution. The solution is to control the core elements of your business. And when you are in control of those core elements, now you can make better decisions about what technology is going to take you to the next level, right? And there are certain things that I don't think a hospital should focus on. That should be outsourced, those kind of things. But there are core fundamental pieces of your organization that you should own, and you should be better than anyone else at it, right? And, you know, part of that is training. You need to train your staff. But, you know, that's not a revenue producing position.
All right.
They're the first positions to go. We don't train them. And then we just expect the person who wasn't trained properly to train the next group that comes in.
Yep.
So, you know, if we can get a hold of our businesses and start to understand these smaller pieces, then we can make better decisions about how to move forward with technologies. But if we just start thinking there's some technology out there that's going to fix my problem, it's not. It doesn't exist.
So I used to work for a technology company that in the healthcare and life sciences vertical, as we were selling, we were told never to speak about patients as customers, right? We were supposed to label them as patients because that's how the provider always, and that made sense. It still does. However, I think there's a healthy element to understanding that these patients are customers. In what other industry would you treat your customers the way you treat your patients sometimes?
And they're people.
Yeah.
I mean, they're customers, but they're people.
Yeah.
I mean, and life happens, and you never know what other things are happening to that person.
Right.
In addition to this medical episode. I mean, I think we have to remember that.
100%.
We talk about patient-centric, but it's really people-centric.
It is people-centric. I think clinicians have patients. I'm in the business side of healthcare. I don't have patients. I have customers. And that's my job to help the hospital negotiate that relationship. But as we said, there are a lot of dynamics to this, and some we could talk about for hours and hours on end. I mean, we're just touching the high level tip of the icebergs here.
But what I love about this conversation and what I hope our listeners are getting out of it is the revenue cycle isn't a money machine. It's not a cash machine. It truly is the bridge between the provider and the community. And the healthier our revenue cycle is, the healthier our community is, the healthier our business is also.
That's right.
There's a lot of external factors that we can't control in a revenue cycle. That's probably never going to change because as soon as we figure it out, it's going to change and we're going to have to figure it out again. But to your point, Jeff and Laura Lee, there are core elements to that revenue cycle that if we can get a strong foundation built, then we can start looking to optimize in other ways. But let's not get distracted until we know exactly what the core part of our business is performing like.
Yeah. You can't make decisions about where to go if you don't even understand what's going on in your house.
Yeah.
Right.
Well said. Last question. Not big honky tonk people. You're not big dancers. What's your favorite country music artist? Laura Lee.
I would consider myself old school. He is really old school. I'm a huge Brooks and Dunn fan. We lived in Nashville for 8 years, and we were blessed enough to be good friends with Ronnie Dunn's son and daughter-in-law.
Wow.
She actually cut her hair. And so we got to hang out with Ronnie and Kix, and really, really nice people, but I love their music. And maybe one day you can, not that we've ever done this live in person, but certainly in the truck, we sing a pretty mean Neon Moon duet.
You're mic'd up.
Yeah.
No, not today. Not today.
You're going to take it back even farther, huh? Even more old school.
Yeah, that's probably one of the toughest questions you can ask. I mean, there are so many that I love, and George is, he's the king. But I was always a big Waylon Jennings fan, and but I love Willie. I love Charlie Daniels, another big fan. I'm a fan of his. Got to see him a couple times, and so boy, that's tough. I can't pin it down to one.
Well,
I think in like more current, I'm certainly a Chris Stapleton fan.
yeah, I am too.
Big time Chris Stapleton
He
fan.
seems to know what he's doing.
Yeah.
He's got
Monday
it.
Night
He's got it
Football. Yeah,
They did it right.
Here tonight. Yeah, I'm all there.
Yeah. Well, Billy Bob's is a great place to build community. Country music's a great way to build community. And the revenue cycle, not to be too corny or cliche here, is truly one of the most important elements of building a strong community, which is going to be even more important as the population in DFW grows. And you guys are right in the middle of it, and we thank you for what you do. And we appreciate you being here at Billy Bob's with us.
Thank you for having us.
Thank you.
Thank
Glad
you.
to be here.